Hi, Dr. Hizon, here to talk about the documentation for a patient with anxiety. So please refer to your particular doctor, as this is a general course not intended to be medical treatment. Your particular situation may vary. So with anxiety, it has a lot of symptoms. Anxiety is the body's natural response to stress. You can get increased heart rate, rapid breathing, restlessness, trouble concentrating, difficulty falling asleep. You can get nightmares, panic attacks, and also painful thoughts and or memories. On the physical exam, we're attempting to rule out any underlying medical conditions, and on the neurologic exam, again, looking for medical conditions and a mental status exam and or questionnaires. There'll be history, physical exam, labs if indicated, and then x-rays may be indicated if there's abnormal neurologic findings. The treatment, you can use medications, you can use consultants, you can do referrals as indicated, and typically there's lifestyle modifications. We might want them to get back into balance with some exercise, nutrition, and better sleep. The medications, we can use anxiolytics, which are anti-anxiety. We can use antidepressants. We can use beta blockers. And then we can do psychotherapy, cognitive behavior, such as having them see a psychologist or counselor. And then with the lifestyles we talked about, get plenty of sleep, stay active and exercise, eat a healthy diet, avoid alcohol, too much caffeine, stop tobacco smoking, medications, treatments, and then see your primary care physician and or specialist as prescribed. So on documenting for the patient with anxiety, typical chief complaint would be a something-year-old, so like say 20-year-old or 30-year-old, and it'd be male and female, complains of mood or behavior symptoms for how many symptoms of, like say, anxiety or depression, and for how many days. You may want to also talk a little bit about the past medical history in that line. Now, in the history of the present illness template, again, you'd be similar to what we had just said, but it's so-and-so is a 20-year-old male who presents today for mood and behavior changes that occurred for how many days or months. When did it start? Approximately. And then, is there any details as to the mechanism that might have set it off? Was there a traumatic event? You could look at their past medical history and family history of mental health disorders and all their symptoms. Do they rate them so many numbers out of 10, with 10 being the worst of their symptoms, with both rest and activity? Are there things that interfere with their daily activities? Are they having feelings such as nervousness, restlessness, trouble concentrating, thinking about others, or worry? Is it constant or intermittent in terms of its duration and timing? Are there associated symptoms and conditions, especially like, does their heart rate go up? Is there breathing rapidly, sweating, trembling, feeling weak or tired? And then it's always nice to know provocation. What makes it worse? And then alleviation. What makes it better? Say if they can relax and do some nice breathing, does that help them? Associated symptoms, like are they tired or are they sweating? Do they have recent stressors or losses? Do they have any numbness at all, pounding in the chest? And then other mood or behavior changes. Have they had history in the past of previous head injuries, concussions? How have they been treated so far in terms of medications and treatments? What have they done so far in terms of previous workups? Have they had labs? Have they seen a psychologist? Have they seen a psychiatrist? Have they seen a neurologist? And then in the past medical family social history and review systems, we like to know if they're a tobacco smoker, how's their exercise program, nutrition plan, and how is their sleep. On the review of systems, you can go through them, and you also want to know constitutional symptoms such as have they had any weight loss or weight gain. On the objective template, generally you want to look at are they in mild or moderate or severe distress. Then you'll go through usually heart, lung, abdomen, but also then especially focus on the neurologic examination, the cranial nerves. Remember, there's 12 cranial nerves. How is their strength, their sensation, their deep tendon reflexes? Do they have any cerebellar signs? And if in doubt, you want to have them do it all. And so a thorough neurologic exam is important. And then a psychiatric mental status exam in terms of, is their speech, is it a normal rate, or are they having a push of speech? how is their thought process? Do they have any feelings of suicidal ideations, or HI is homicidal ideations? Do they have psychotic symptoms? Do they have problems with their attention, concentration, mood and affect, judgment and insight? And then in the assessment medical decision making, is it a simple or is it a complicated case? Does it require straightforward or complex decision making? And this is where the physician and or provider may discuss the reasons and rationale for the treatment. On your diagnostic ICD-10 codes, there are usually F codes. Anxiety due to unknown physiologic condition is F06.4, as well as these other ones that are available for you to use. Talk to your provider for the specifics. And then on the plan, there's usually medications, there's therapies as prescribed, specialty consultations if that's needed, and a follow-up with your primary care physician and or specialty provider. In terms of pearls and pitfalls, if they have any symptoms that have laterality, meaning left or right, make sure you get that correct. Be sure to document all symptoms and duration. You want to know their past medical history, conditions, traumas, losses, things that would add to their stressors. Have they had any past medical health disorders? How about family history of mental health disorders? And then learn the various questions and physical exam tests to perform, such as a family history, social history, history of the present illness, and neurologic exam. And then please ask your physician or provider if you have any questions about the evaluation that needs to be documented for the patient with anxiety. And in primary care, ask about quality measures, such as preventative type things, such as mammograms and colonoscopies. So takeaway points with the patient with anxiety: it is a mind and body's reaction to stress. The treatment requires the patient's cooperation and compliance. Diagnosis depends on detailed symptoms and accurate history of the present illness. It's important to rule out any other diseases or illnesses that could be causing it. And I encourage the informatician to study hard to learn the various questions to ask, such as the accurate history of the present illness and exam. Learn required mental health questionnaires to assist the provider, such as the PHQ-9 type test. And again, we want to thank you, because while we doctors save lives, medical informatics scribes save doctors. Thank you.